What is the most absurd historical fact you know? A surgeon who conducted a surgery with a 300% mortality rate. Robert Liston was a 19th century Scottish surgeon and wasn't a bad surgeon for the standards at the time. On the 21st of December 1846, Scottish surgeon and medical pioneer Robert Liston used anesthetic ether for the first time in a British operation at University College Hospital, London. At the time, Liston was regarded as one of the best surgeons in the country. Liston was noted for his skill in an era prior to anesthetics, when speed made a difference in terms of pain and survival. He was often also called the fastest knife in the West End. This dissecting case once belonged to the great Robert Liston. These arteries of this hand have been preserved by being injected with wax. This specimen was prepared by surgeon Robert Liston. In modern times, it's hard to imagine surgery without anesthesia, performed on an awake, restrained, wailing patient. However, this was once the norm. Surgeons had to work swiftly and precisely to minimize pain and blood loss. Robert Liston was a master of this era, known for his lightning speed and skill. His rapid operations often resulted in fewer post-operative infections compared to his peers. Despite being described as crude, loud, abrasive, insensitive, and brutally rough with trainees and colleagues, Liston was a brilliant surgeon. He also designed many surgical instruments still in use today, authored books, and was an avid reader of medical advances. Notably, he performed the first surgery under anesthesia in Europe. His remarkable ability to save lives and his contributions to surgery deserve recognition and appreciation. His speed also resulted in some bizarre operative events that earned him ridicule in surgical history. He could amputate a leg in just 2.5 minutes. But tearing through operations with such speed and agility did not come without its risks. While amputating a patient's leg, Liston brought the knife down so fast through the patient, he accidentally chopped off the fingers of his assistant, who was holding the leg steady for him. While withdrawing the knife quickly, he sliced the coattails of a man standing next to him. The bystander, believing himself to be wounded, fainted. In the aftermath of the surgery, both the patient and the assistant died from infection, possibly gangrene or sepsis. It also turned out that the bystander who fainted actually had a heart attack and died. So an operation on one man led to the death of 3 men, making it probably the deadliest operation in history. The fastest knife in the West End, Robert Liston died at the age of 53 in 1847.